In Phoenix, Arizona, a sophisticated system of air ambulance helicopters services thousands of seriously injured patients each year from anywhere within 150 miles of the city. This story is not a recreation. It's a ride with Samaritan Air Evac, one of the busiest air ambulance services in the country.
Airback 1 scramble. Pinell County Sheriff requests you on a 962 milepost 168 on Highway 84.
A late afternoon call sends Air Evac 1 to a head-on collision on a highway.
3 fatalities on the scene. Airbac 1 scramble 1824. Clear. But we'll notify us 1647.
30 minutes, okay?
The air ambulance picks up the critically injured survivors at the scene.
Be advised, both our patients are going to Good Sam. You may want to triage your patient to a different location.
By helicopter, they'll be at a hospital in less than 17 minutes.
The way to have somebody survive is to get them to a trauma center, to the trauma surgeon, to the trauma team as fast as you can.
We're talking chopper saves lives.
911 emergency. Is they on? Hello? What's the matter? Let's see. Little 4-year-old just got kicked by a horse. Okay, let me get you other paramedics. Stay on the line with me, okay? Okay.
A 911 call about a seriously injured child in a remote location. An air ambulance is immediately dispatched.
Airback 2 scramble.
Airback 2, copy, scramble.
2 copy scramble.
When the tone goes off, immediately the adrenaline's going because you know it's showtime.
Airback 2 scramble 1613. Have a child kicked in the face by a horse.
Flight nurse Cindy Gaspar and the crew of Air Evac 2 respond.
As you're listening to the call and finding out what it's going to be, you start planning and what you're going to do. And if you know it's a kid, if you know it's a pediatric patient, your heart's beating faster. It's a given. Nobody likes to do pediatrics. It's more involved, it's more intense, and people are a little bit more excited.
4-year-old Regina Ann Ellis was accidentally knocked down by a horse and stepped on.
Yeah, me always.
The first thing I remember hearing was a loud scream, which made me feel good because I knew that she had an airway.
No, I won't give you shot. No shot.
Well, tell her I'm going to do that for her.
No shot.
She took a severe blow to her face. I knew she had facial fractures.
In the stomach, and then when the horse was trying to take off, it stepped on her. Now, I was let out there.
When you have a pediatric patient, you've got family to deal with too. You've got a mother there. That's her child, and she needs to know what's going on.
There's little Patricia Ellis can do but try to comfort her child.
My initial thought was her whole face had just caved in, but I tried to calm myself down because she was so upset. I probably would have been going insane, pulling my hair out of my head if I wouldn't have been helping hold her head while they were checking her out.
The farm they were visiting is more than an hour by ground from the nearest trauma center. By air, it's only 15 minutes.
Man, we're going to take real good care of her, okay?
You've got a lot of people there helping. There's a lot of things going on, and somebody's got to put it all together and wrap it all up. We have a 12-minute rule. We try to get on and off the ground in 12 minutes or less. So it's fast. I mean, it's fast and it flies.
Copy. Okay, we've got a line started at 22, and we've got her C-spine on a KED board.
And I noticed a lot more swelling as we were flying, and I noticed that she was getting sleepy. So that tells us that she could have neurological problems.
Let's get her stimulated a little bit, see what she's doing.
And you have a closed space like the skull, and you have tissue like the brain that takes an insult, it can swell.
Okay, Gina.
Okay.
If that does indeed happen, there can be permanent neurological damage.
By the time the helicopter lands at Phoenix Children's Hospital, trauma surgeon Frank Sacco is waiting to examine Regina.
She was a brave little girl. Usually you get a real good idea of their personality just within a few minutes, and it was pretty obvious that she's a fighter, and she's a survivor.
Mrs. Ellis.
is the right person.
When I walked in and they said that they thought she had already been in surgery, the only thing that I could think of was the blood that I saw her spitting up was a punctured lung. But then when they came over and said that they were scheduled to go in and sew her lip up, I was really relieved. I was really relieved.
As soon as he heard about her accident, Regina's father, Edwin Ellis, went to see her.
I need to carry you, Katie.
She was really beat up, you know, and I couldn't believe that was even her.
Daddy, big hug, sweetie.
If someone had told me that was Regina, I wouldn't have believed it. And of course, I went to pieces then. It's hard to speculate what the outcome would have been had they not flown her in here. She had lost so much blood that her blood count was low. And that was just in a 13-minute trip. What would a 45-minute trip done?
Plastic surgeon William Layton was on call.
Whole left cheekbone and the side of her nose and her palate or maxilla are completely fractured here.
She was very lucky that she didn't sustain a significant head injury or injury to her brain that could have caused some permanent damage. And I think her care in getting her to the hospital and into the trauma center was outstanding.
You're going to go to sleep in just a minute. Everything's going to be just fine. You're looking so good.
We then took her to the operating room and made an incision from ear to ear, made some incisions inside her mouth and through her lower eyelid, and then fixed all the facial fractures with multiple screws and plates and wires.
All I could think about was, was her face going to be looking normal by the time they're done? And that was my main concern, and to make sure that there was nothing damaged inside of her brain or her eyes or something.
3 weeks later, Regina is well on her way to full recovery. In time, her scars will not even be visible.
I think she's learned a lesson. I don't think she's really had a fear of animals. She's been right back in there. So I don't think she'll be scared of them.
Have to be careful on horses. I'm not putting them no more.
The thing that really impressed me was the woman that was, a paramedic on the helicopter took time out to drive over here and bring Regina a little stuffed teddy bear and a set of medevac aircrew wings, and just to see how she was doing, and she was genuinely concerned with her condition and how she was doing. Yeah, they're heroes. They can have whatever I got.